So every day that the catheter is in place, there's an increased risk of infection and the development of biofilm, which would make infections difficult to treat. So some of the steps we can take to decrease the risk of infection include, again, practicing the hand hygiene before we handle the catheter, maintain a sterile, closed drainage system, provide routine hygiene care. Now, the recommendation is that the hygiene care is provided at least once per day and after any bowel movements. Again, refer to your facility's policies and maybe more frequent at your place of employment. We want to keep the collection bag below the level of the bladder at all times. Replace the entire system if it becomes contaminated. Empty the collecting system regularly using a separate container for each patient, making sure that urine flow remains unobstructed. And if we need to obtain urine cultures, we want to get that from the sampling port. I mentioned biofilms a moment ago. So biofilms can form on any indwelling medical device, and that includes catheters. And it forms when proteins, electrolytes, and pathogens attach to the surface of the catheter. Sometimes if you see this, it actually looks and feels slimy. It becomes an immobile community that's difficult to eradicate, and it allows bacteria to flourish. So while bacteria can move in and out of this and can cause infections, antibiotics are really most of the time unable to penetrate the biofilm to actually get rid of an infection.